So here at Weldmar we have a motor neurone disease joint clinic. It's run every 2 months and people are invited according to their need and their wish. They are invited to attend for some monitoring, so if they don't mind being weighed, and if people are agreeable, we also check their lung function as well. And then they're invited to come in and see the doctors and myself all in one room together, where there's an opportunity to ask questions, catch up with them, talk about things that are happening and making perhaps a plan for the future as well.
When people come to our MND clinics, they're given the opportunity to have an occupational therapy review. And that gives us a chance to see how their disease is progressing in terms of how they're managing to move, how their hand function is, what their respiratory function is like, and then in turn to see how that's affecting their ability to take part in daily activities. And so once we've had that review, we can then have an opportunity to give them advice, techniques, or perhaps even equipment to help them be able to be a little bit more independent in those activities.
It's a clinic that helps people manage symptoms and helps people to maintain their independence. We have built up over the last 20 years, since the hospice has opened, an expertise in motor neurone disease, hence the multidisciplinary approach to looking after patients with motor neurone disease.
We work closely with Weldmar Hospicecare staff, and our aim is to be available to people with MND to help them on their journey, their carers, especially as their disease progresses, and the rest of their family, and to be available to them by whatever means they feel appropriate. So it might be that we'll visit them at home, it could be that we telephone them or use technology, whatever suits them, to make sure that they've got all the accurate information, and much of that is produced by the Motor Neurone Disease Association. We also have access to other services provided by the Motor Neurone Disease Association, including counselling for children and young adults, welfare benefits advice, all sorts of things that we can introduce them to and support them with while they make choices about how they're going to lead the rest of their lives.
In the UK at any one time, there's approximately 5,000 people who have motor neurone disease, and that translates in Dorset to somewhere between 20 and 25 patients coming to our clinic or being on our clinic books at any one time. The significance of that is that most GPs in their career aren't likely to see a patient with motor neurone disease, and that's why a multidisciplinary approach is important, taking into account a neurological opinion and a palliative medicine opinion at the same time.
So the clinics, we have a person-centred approach. We aim to be supportive to families, so people normally come with a family member or a carer or even a friend.
When our patients come to Weldmar to attend the MND clinic, we try to make people feel comfortable and at ease, meeting all the members of the multidisciplinary team. Appreciate it can be quite a daunting experience, but we hope we give people the time and the space necessary to help them feel comfortable attending this clinic.